and welcome to Excellence in Practice, Voices for Better Care, a podcast by the National Centre of Excellence in Intellectual Disability Health. Here we will be sharing real stories and advice from expert clinicians and people with lived experience on improving healthcare for people with intellectual disability. We hope you enjoy this episode. I'm Ricky Kremer and I am co-hosting with Raylene Griffiths.
The National Centre of Excellence in Intellectual Disability Health recognises and respects the traditional custodians of country across Australia. We acknowledge their deep and ongoing connection to land, waters and community and pay our respect to elders past and present.
This podcast includes discussions about the healthcare experiences of people with intellectual disability. Some stories may include mentions of trauma, medical mistreatment, or discrimination, and could be distressing for some listeners. If you are uncomfortable, please take a break or skip this episode. Thank you for joining us for this episode on communication with people with intellectual disability in healthcare. Good communication is important for safe, respectful, and effective healthcare. It is important for healthcare professionals to learn how to improve their communication when working with people with intellectual disability. In this episode, we will be speaking to Nick Lennox, who is a member of the Centre's Council and an experienced clinician, professor, and researcher, who is currently the Senior Medical Advisory to the Primary Care Division of the Department of Health, Disability and Aged Care. We will also be speaking to Beck Biddle, who is a member of the Centre's Learn and Lead group and has worked as a self-advocate for disability rights for over 10 years. Thank you, Nick and Beck, for joining us to talk about such an important topic. To our listeners, we hope you enjoy the episode and learn about how you can use better communication to improve healthcare for people with intellectual disabilities.
Hi Nick, thank you for joining us today. Can you please start by telling us about yourself and your experience working with people with intellectual disability in healthcare?
Thanks, Raylene. Yes, I'm pleased to be here today. My experience is that, in fact, it goes back a long way, and it goes back. I grew up in an area where people with intellectual disabilities were neighbours and friends of the families, and trained in medicine in Tasmania. And then once I finished training, worked in New Zealand as a junior doctor and as a registrar, what other doctors call registrars and health professionals. Both in training in general practice and also delivering babies, and then also training to be a psychiatrist. And then I came back and worked in Melbourne for 10 years, 1 year working in psychiatry at Monash Medical Centre. And then because of some personal tragedy, I decided that I wanted to get out of psychiatry and I was feeling disenchanted with it. And I moved back and worked in general practice. In 1992, I was working as a GP in Northcote in Melbourne, and I started and applied and got a job working specifically with people with intellectual disabilities, heading up a centre, eventually heading up a centre at the University of Melbourne. And then I was asked to head up a centre at the University of Queensland, which I did from 1997 to 2018. So my experience was both as a GP and in other roles, and as a psychiatrist working with people with intellectual disability, and then having a specialist service which I headed up at both the University of Melbourne and the community health centres, and also at the Mater Hospitals, which is part of the University in Queensland, which I did up until 2020. Since then, I retired. Sorry, I did till 2018, and then since then I retired, but was asked to rejoin and become a medical advisor, which I am now, to the federal government on the roadmap and also on the pandemic response. So I've been working as a medical advisor up until for the last 5 years.
Thank you, Nick. Based on your experience, what are some of the biggest communication challenges you've seen in healthcare for people with intellectual disability?
Yeah, so when thinking about this, I see the major communication challenges at the very core is the profound devaluing of people with intellectual disability and often exclusion on the basis of that devaluing. And I think clinicians actually everybody can make really inaccurate assumptions about people and their lives on judgments that they've got and have grown up making about people who may be seen as different from themselves. The other, I think, biggest barrier to communication is the environments that we provide healthcare to people with intellectual disability. Noisy places, crowded places, places that make people quite anxious and not necessarily very welcome. The other challenges I've seen in providing both I think also seeing both when I was a GP, but also when I was providing a kind of a specialist directed service was a massive failure of support staff for people that needed support staff to bring communication aids or even to be organised and bring vital information to me as a doctor that I need to know to make some really distinct decisions about people and to actually understand what their life is about and what in the ways I can possibly help them. The other failure is often people who are supporting people with intellectual disabilities that need support are just from support organisations are just not informed about the person's life or the person, and that is a major problem. When I think about the communication, one of the big problems we face in healthcare is poor communication between healthcare providers, like between doctors and other staff, between allied health staff, between nurses, between hospitals and general practices. And I think that is a major communication barrier. And sometimes that's all, very much embedded in records and stuff like that. And what this does is that what we do is we lose the story about people's lives. And for me as a doctor, it's really important that I understand your health story and your life story to a large degree to be able to do my job really well. So that'd be the main communication issues that I've seen over the years. Thanks, Raylene.
Thank you. Could you tell us about a time when you worked with a patient or their family to overcome a challenge with communication? What did you do to change your practice?
So when thinking about this, what struck me as a GP was it's actually kind of you've got so much pressure on you of time as a GP. Like you're chasing your tail often a lot, and you're out there, and you might have a full waiting room, and lots of people need to see you, and you've only got so much amount of time available. So one of the things I think actually, and it's like, everybody knows this in healthcare, but I think it's really important, and I did it actively in my world, to first talk to the person. And sometimes, staff will bring in somebody or family will bring in somebody, and it's really important as a GP to just ignore what everybody else wants you to do. In other words, talk to them and just reach out to the person with intellectual disability, make eye contact, smile, possibly touch the back of their hand, and say, this is about you in all your body language. So that was one of the things that I tried to absolutely do. And the other thing I would say is listen, listen, listen. And what I tended to not do, but I have done in the past, is to also acknowledge how much people have done to be able to get there, and to and the great job that they've done, whether it's the person with intellectual disabilities or their support people or the family in particular, often not acknowledged. And for GPs particularly, I think one of the beauties of general practice is that you can get people back and see them again and again and again, and it's called review, review, review. And it doesn't matter what your role in healthcare is, but particularly for general practice, that is one of the real powers of general practice, is that we can build a relationship with people, and that we can look again and again and again and kind of ask the questions. The other thing I've done also for staff is what happens with all these communication issues is that we lose information about people, or can do, important information. So I absolutely insist, particularly where the support staff is involved, is that people record things so that when they come to see me, I will know whether when they've maybe had a seizure, or when the person's has a seizure, and how often they had them and what type of seizures they were, or have they moved their bowels, and how often that occurred, or what it was like, and actually write it down. Because if it's not written down, it can get lost, and it's really, really important. It sounds kind of a bit of a pain to do all that, but really it just helped enormously. And I can't, in some cases, particularly where people have got very complex health needs, to tease out the little bits by recording are really important. And finally, I would insist on, as strongly as I possibly could, when I was seeing people that required paid support staff, that they had paid support staff that were well informed and well connected and trusted by the person that they're supporting. So they're the key things I would do if I was in practice. And I'm not working as a GP now, but as a GP, you'd have to take some of those things and see how you can do. That would be my suggestions in terms of adapting your practice and thinking about what you can do in your practice. Thanks, Raylene.
Thank you for sharing that, Nick. You also have a lot of experience as a researcher. What are some changes healthcare workers can make to improve the experience for people with intellectual disability in healthcare based on your research?
The other thing I think is actually to be flexible in delivery of your healthcare. There are going to be people that you have in your practice that have been very traumatised by life in general, by kids they went to school with, by the healthcare system, by the disability support system. And so I think being flexible and perhaps, seeing people in their car if they can't get into the surgery or whatever, or even in their home if possible. I would strongly consider now with the use of telehealth, that where people are finding it very difficult to get into the consultation, that you use telehealth with them and also the people that support them. I think this is a really powerful tool, because a lot of healthcare is understanding the story, the person's story. And it also can be, for GPs, it's also relatively time efficient. Clearly, you'd have to back that up with other stuff. And broadly, and I guess it's probably the last question I'm answering here too, but go slow, go gently, and go respectfully in providing healthcare. Answering your question about research, I would highly recommend, beyond highly recommend, that people do a comprehensive health assessment program review, a health review or a health check every year. And the tool that's been demonstrated, the only tool that's been demonstrated to do and improve health outcome is the CHAP tool, which is the Comprehensive Health Assessment Program, which is freely available across Australia for GPs and people with intellectual disability. It is the only process that has been demonstrated to improve health outcomes for people with intellectual disability. And I would say to GPs that they really should be doing this, and people with intellectual disabilities should be getting this yearly. For GPs, the other thing that I think is important is you can do a health review, and then you can do a disease management plan, such as a chronic disease management plan or a mental health plan, as a separate process. And it gives the GPs a kind of a structure about what we need to do, particularly if people who've got lots of things going on. So I think that's really useful. And finally, this is not on my research, but it's this development, the increased funding that the federal government's invested in primary healthcare over the last few years, the development of My Medicare, and GPs can register with My Medicare and people with intellectual disabilities can register with that practice. There is real benefits in that in terms of improved access. And I think that GPs, it'll support them to deliver healthcare better and improve the access for people with intellectual disability. So I would do that as well if I was in general practice. Thanks, Raylene.
Thank you for that great advice. Is there anything else you would say to healthcare professionals who want to make their practices more inclusive and accessible for people with intellectual disability?
Okay, well, my thoughts about this is this. As part of my ongoing registration as a GP, is I have to do continual professional development, and you can do a practice improvement process, and in that, actually seek the advice of the people with intellectual disability that you see and the families, and say, actually, how can we do this better? How can we do it better for you and to make it work better for us? Actually do that as a practice improvement project would be really good. The other thing I think is really important is actually to develop, and some practices have done this, develop a register so they know who in their practice has got an intellectual disability, and therefore set up recall systems for things like annual health checks with the CHAP. A useful process so you actually know and can target things, because we know that people with intellectual disabilities miss out on a lot of preventive health checks. So it acts as a checking process to know what's going on. And finally, I worked in practices at times with a practice nurse, and I found it almost very, very valuable to engage the practice nurse in the delivery of the healthcare to people with intellectual disabilities and other people where I needed extra support into doing my job as well as possible. That includes the practice nurse being involved in the development in the use of the CHAP tool and the annual health review, which can make it, I think, more acceptable to people with intellectual disabilities and easier, and also possibly, although I don't have the research to support it, a better process for people with intellectual disabilities and a better process in terms of improving their healthcare. So those would be the things that I would suggest healthcare professionals could think about, and particularly, I guess, general practitioners. Thanks, Raylene.
Thank you. Thank you for your time and for sharing all that great information. I'd also like to say to you, Nick Lennox, it's been a pleasure to work with you today. I really got a sense that you care for your equal human rights of people with intellectual disability. Thanks very much.
Bye.
Thank you, Nick, for sharing your experiences and stories as a clinician and researcher. We will now hear from Beck Biddle, who will share her experience with and advice on communication in healthcare. Hi, Beck. Thanks for joining us today. Can you please start by introducing yourself and your work?
Thank you, Ricky. I will. My name is Beck. I have an intellectual disability. I'm a disability advocate. I'm also a member of the Learning-Led group.
That's great. Well, thank you for joining us for this episode on communication. So, can you tell us about what your experience has been like in the healthcare system?
I can. My experience with the healthcare system has been both good and bad. But the bad experience I had is where I had a huge seizure at a friend's place, and the ambulance took me to the hospital, but they didn't even bother cleaning me up check if I had a brain injury because it happened outside and I hit my head several times. And they didn't. The nurse said, didn't even bother checking on me, didn't even bother cleaning me up, just told my mum to take me home and put me to bed. And that was, yeah. And that was a near-death experience. So I was told I almost died. So the other time was when I was waiting in hospital in the emergency service because I couldn't go to the toilet or anything. I was really blocked up and they just told me to go home at first. I think it was like after 2 hours, go home, drink water. Then I had to go back in and I was there waiting for 6 hours and I was just really, I was just really badly blocked up. And worked, I had hemorrhoids. So that was like a 6-hour wait in the emergency service. It was really bad experience. I was in so much pain. So yeah.
Yeah, that's not great. First of all, thank you for sharing your experiences. What challenges have you had with communication in healthcare? And have there been times when you weren't listened to or didn't feel understood by your healthcare workers?
There are times where communication been difficult where I felt they haven't listened to me or I've been told it's in my brain for some reason and they just didn't take me seriously. There was times so that's been really hard. I've had to for pretty much all my life. My mum has been my one who's been talking for me because I get very nervous talking to doctors and specialists. So they tend to look at her, but even they've said like a lot of times they don't explain anything in English, and they're just more interested with either putting me on medication or saying that there was that it was in my head or that go home and rest up.
Well, thank you for sharing those challenges. Can you tell us about a time when you felt you were listened to and understood and comfortable with a healthcare professional?
I can. I had a really good doctor, but he's no longer a doctor anymore because he retired. But I used to work at a supermarket and I suffered from really bad back pain. Like it was literally aching. I couldn't even get up or do things. He got me to do some tests and then he had like a dummy thing and he explained what was going on with my back. And he said how I had a slip disc and this what was causing the pain and told me what to do and put me on some pain medication. So that was really good. He was a fantastic doctor, but he no longer he's retired now. But yeah, he used to explain things to me like with dummies and stuff, medical dummies. So yeah.
Yeah, that's great. Thank you for sharing your more positive experience. So, what tools have healthcare professionals used that have helped you to better understand them and feel comfortable?
I would say explain stuff to me like on a like a dummy kind of thing. Or is doing stuff in easy English, explaining in plain English to me, easy English so I can understand. Because if I don't understand, my mum will always speak up and say, "What does that mean?" And then that doctor will put it into plain English to try and find a plain English to explain what it is. So yeah.
Did you ever have a support worker go with you at all, or mainly just yourself?
Just myself and my mum. So my mum will be my support worker. I had a one support worker go with me to a dentist. So that was really good because I have really bad teeth pain, like tooth pain all the time, and I had my support worker take me to the dentist in Colac. So that was really good.
Yeah, that's fantastic. And what do you wish healthcare professionals knew about communication when treating people with intellectual disability?
To just listen to us, to talk directly to us, ask if we've got a support worker, ask if they want us to talk or a support worker talk for us or our family member talk to us. Explain to us in easy English. You can even use a device like my doctor had in Cobden. It was it was a actual spine device and then explain what's going on. It's another easy way. Give us time. always give us time to speak, because I find that they're always in a rush. Don't always put us onto medication. Do thorough checkups always. I mean, just because look, I got a flu, it could be something else going on because I have an intellectual disability plus autism. It could be something else. Plus, I have epilepsy as well. So it's, it's not always going to be a flu. It could be something medical going on because there's medical problems, health problems in my family. So it does concern me that it may not be a flu, and I would rather have a full checkup and test done to find out what's happening here. So I want doctors to understand that too, and always listen to us and give us time. Explain to us stuff in easy English, and if it's just showing us on a device like a medical device, machine, or whatever, or dummy thing, show us what's going on, and just make yeah. That's basically that's it. Yeah.
Like make an effort to do it. Obviously they're not going to get it right, all the time, but at least they try and
Exactly.
yeah,
Exactly.
yeah,
Yeah.
absolutely. Thank you, and you have shared a lot of great information. Is there any advice you would love to give to healthcare professionals who want to make their practices more inclusive and accessible for people with intellectual disability?
Yes, don't keep us waiting in the doctor's room, in the waiting room for too long. If the doctor's behind, let us know. Like, give us contact me if they're behind, because the one thing that can cause me to have anxiety is sitting in the waiting room for over an hour, because I have anxiety, very high anxiety due to my autism. I'm not going to sit around for an hour. So it's just because the noise and everything around me is just going to be way too much for me to handle. So if you've got a quiet room, would be great, because I didn't even know, like the doctor's surgery I went to the other day actually has a quiet room. So if I knew that, I wouldn't have freaked out as much and called my mum, because I went in by myself, and it was first time ever doing it myself, and it was kind of freaky. So I ended up calling her up because I was waiting and waiting, and then I found out they had a quiet room. So that was really, really good to know. Who do you want us? If you want me to talk, you ask me if I want to talk, or I want my mum to talk for me. Yeah, if my anxiety is very high. Basic training in disability. I can't stress that enough. I love to have doctors that are basically trained in disability, but not just intellectual, but also all disability types of disability, because I feel that a lot of them don't have an understanding of disability, or what it is, or some of the health issues people, especially, they have no clue of some of the health issues that people with intellectual disability have. And respect, and talk to us in a respectful way. Always respect it, because I have come across some doctors that have been really quite rude and not so nice. So, respect us is one. Listen to us. Easy English. Show us what's happening, and for our checkups and tests, and give us time to talk. And also ask us, does it me you want to talk? No, ask if I want to talk, or do I want my mum to talk? Because if my anxiety is at the high risk, I may wish to have my mum talk for me, because she knows my history. So, yeah.
Yeah, absolutely. So I know you work with Learn and Lead in terms of making a difference. Is there anything that stands out that you do with Learn and Lead that you feel is very beneficial?
I think it's all beneficial, but the one thing I think I find that we're all in the same situation when it comes to doctors and nurses. How we feel that we're trying, we want to educate, and we want to train doctors. We want to be the ones behind the training the around disability and communication. I don't even see a communication board in some of the doctors. I don't even see sign languages. And you got people also from multiple backgrounds that may need someone like someone to translate stuff, for them. So it's in the country that's lacking quite a bit. It probably lacks in the city as well, but the country, it's really, the doctors here really, communication is not one of their high keys, especially with disability.
Yeah, that's great. And you guys are doing a really great job.
Thank you.
Speaking up, and yeah, fantastic.
Yeah,
So thank you for being
you're
on the
welcome.
podcast.
Thank you, Ricky. And thank you for having me.
Thank you for listening to Excellence in Practice, Voices for Better Care. We hope you enjoyed the episode and learned more about delivering better care for people with intellectual disability. If you've been affected by anything discussed in this episode, please know you're not alone. Support is available. If you're in crisis or need someone to talk to, you can contact Lifeline at 131114 in Australia. To learn more about the work of the National Centre of Excellence in Intellectual Disability Health or to get involved, visit our website nceidh.org.au.